Mass reinstatement at CDC, a closer look at the turbulent workforce changes. In a recent development, approximately 180 employees of the Centers for Disease Control and Prevention, CDC, have been reinstated just 2 weeks after their abrupt termination. This reversal underscores the complexities and challenges within federal workforce management under the current administration. Initial terminations. In mid-February 2025, the Trump administration, through the Department of Government Efficiency, DOGE, led by Elon Musk, initiated significant layoffs across various federal agencies, including the CDC. The initial plan aimed to reduce the CDC's workforce by about 1,300 employees, primarily targeting probationary staff. However, the actual number of terminations ranged between 700 and 750. Reinstatement notification. On March 4th, approximately 180 of these terminated CDC employees received urgent emails instructing them to return to their positions. The subject line of the email read, "Read this email immediately," and the content indicated that, after further review, the February 15th termination notices had been rescinded. The employees were directed to resume their duties under their previous work schedules with an apology for any disruption caused, roles and responsibilities of affected employees. The reinstated personnel include outbreak responders participating in fellowship programs designed to provide hands-on public health experience. Their roles are crucial in managing public health emergencies and ensuring the nation's health security. Wider implications and reactions. The CDC's staffing changes are part of broader federal workforce reductions implemented by the Trump administration under DOGE. Other agencies, such as the Internal Revenue Service, IRS, and the Department of Veterans Affairs, VA, have also experienced significant layoffs. The IRS faces a potential 50% reduction in staff, with up to 90,000 employees at risk, while the VA has already seen 1,000 workers laid off, with an additional 80,000 positions potentially vulnerable. These widespread layoffs have sparked legal challenges and public criticism. Labor unions have filed lawsuits alleging that the mass firings violate principles of separation of powers and due process rights. Some judges have issued temporary restraining orders to halt further terminations pending legal review. Official statements. Health and Human Services Secretary Robert F. Kennedy Jr. has emphasized a commitment to radical transparency within the department amidst these changes. CDC spokesman Andrew Nixon noted that the agency currently employs more full-time staff than it did before the COVID-19 pandemic, despite recent layoffs. U.S. Senator Raphael Warnock, D. Georgia, expressed relief over the reinstatements, but stressed the need for the full restoration of all terminated CDC employees to safeguard public health and national security. Conclusion. The recent reinstatement of CDC employees highlights the dynamic and, at times, tumultuous nature of federal workforce management under current administrative policies. As the situation evolves, the balance between governmental efficiency and the maintenance of essential public services remains a critical point of discussion.